We're thrilled to welcome today Dr. Margaret McKenzie, who currently serves as president of South Pointe Hospital, a role that she has held since 2017. If I had to describe Margaret, I would call her both a healer and an educator. And she educates, yes, medical students, and she's incredibly dedicated to them, but also her patients as well as the community. She's received lots of honors in that realm: the Ohio State University Distinguished Professor of the Year Award, Case Western Reserve University Scholarship and Teaching Award, Master Educator of the Year from the Cleveland Clinic. For 9 consecutive years, she was recognized as a top doctor in Cleveland by Cleveland Magazine, and she has co-authored 2 books in numerous journals and served on the Cleveland Clinic Board of Governors. For many of you, what may be most important is I know you're members of her Leadership Cleveland Class of 2019 fan club, and I welcome all of you, as well as I welcome our board member, Brian Morita, who's joining us this morning. Margaret recently joined the Cleveland Leadership Board. We're thrilled to have her incredible lives and educated voice in our room. Now she's going to educate all of us about coronavirus. Welcome, Margaret.
Okay, thank you, Marianne, and hi, Michelle. Oh, everybody's waving. I love all you guys. Thank you for being my cheerleaders. So it's been 3 years, actually, last Friday, since I took this role as the president of South Pointe Hospital. And my journey has been focused on our why, which is, we are actually here to serve. Luckily for us, our new CEO was able to, before it was patients first. And in my gut, I always felt it was more than patients that, and so when our new CEO, Dr. Mihaljevic, joined us 2 years ago and reframed our focus, our North Star on the 4 C's, which is caring for the patient, caring for the caregivers, the people who provide care, caring for our community, and caring for the organization. It really resonated with me and has been basically the framework on which I function every day in everything that I do. So I will tell you, I used to be an obstetrician, and it was really nice. I saw a little baby that I just delivered who's now 16 and a half. As an obstetrician, what I learned is, it doesn't really matter the kind of care you provide during pregnancy. The only thing that really matters is the final outcome: a healthy mother and a healthy baby. And I took care of mostly high-risk patients. So we're talking about people over 35 years old who've got multiple medical problems. And the things that I learned was that in the middle of an emergency, always focus on what matters most. In the middle of that focus, when everything is going haywire, you do have to pause and reflect and pull your teams together. And help them to refocus on what it is you're trying to solve. And then to reassure your team, and then to come up with an action plan, prioritize it, and then drive that plan. I think that at the end of this, one of the things that I do want you to take away from this is that within the toolbox of the Cleveland Clinic, we have several tools, and the number 1 is empathy. Empathy, caring not just for our patients, but also caring for the people who work for us, our caregivers. It is also doing the right thing every time for every patient that walks in the door, whether or not that patient can pay, and regardless of the patient's background. And so we have been focusing on trying to remove disparities long before COVID showed up. To always remember our why, our North Star, what is the focus of everything that we do? To treat patients, caregivers, and the organization like they're your family and like they're your home, because you're always going to go back and do that number 2 thing I spoke about, which is doing the right thing. And then to support and to reassure everyone in the middle of a crisis or on a day-to-day basis that we are actually all in this together. And there's no one that's higher than anyone. There's no one that's more important than anyone. Everyone is of equal importance. And when stuff hits the fan, to jump in with both feet, roll your sleeves up, to stay present, to trust your leadership so that the people that you're leading can trust you, and then to keep refocusing on your why. So what has happened for us during this crisis at the Cleveland Clinic is that we were having a great year. So we were having an outstanding year, at least the last half of last year and the beginning of this year. And we were really focused on driving initiatives that were patient-focused, education-focused, and research-focused, which is basically mission-based work. And then here comes this pandemic. It just lands on us. And I think that it really called on everyone to sort of stop and focus on what's important. Luckily for us, we already had a culture. And the culture was one where communication was transparent and wide. And I would say that communication has even become the lifeblood of our organization, so that at any point in time, there is no secrecy. Everyone knows what's going on at each level of the organization, so that it could prepare them to respond in a way that that the organization, their patients, but the community expect us to do. So some things that we've done is, I would say the first thing we've done is we have embraced this virtual platform. This virtual platform was something that was new for us, and we have been struggling with trying to get it to become a norm, because we know that the millennials and beyond, this is what they're looking for when you're focusing on care. And to be able to extend our care of our patients beyond the four walls was the first thing that we had to quickly pivot to. That took a lot of organization, a lot of teamwork, and a lot of vulnerability. Making yourself willing to suggest ideas that were outrageous, that might not be embraced by all, but then eventually coming to consensus after exposing yourself and making yourself so vulnerable as a leader. So I would say, if you remember Lencioni's 5 dysfunctions of a team, I can clearly stand in this space and say, we have overcome those 5 dysfunctions. We have got incredible trust. There is incredible communication, open communication, and a silence kills mentality. So just to stay silent, it is dangerous for an organization. The accountability, and then clearly for us focusing on outcomes. So things that they've done is we have, let's start with our caregivers. Caregivers who've gotten tested positive within this space, we have provided meals for them at home. There are check-ins with them daily from a team. We have embraced providing psychological tools for them to handle the psychosocial aspects of not just isolation and distancing like the rest of us have to do every day, but when you have a disease and then you're isolated, it makes you feel worse, because even you might be in the same house and your family's got you stuck in one room because nobody else wants to get this. People are afraid to touch you. Everybody's wearing a mask. When you cough, they turn their heads. And so we've had to embrace providing tools for their psychosocial health and emotional health within that crisis. And it is really nice, because embedded in providing that for caregivers, we were able to develop tools that we are now sharing with our patients and with other organizations around the country on how they need to embrace the psychosocial aspects of COVID. And in addition to that, the organization has actually provided meals for like 2 or 3 days a week for hospital employees when they're going home, so as they're leaving a 12-hour shift, that they can actually have a meal so that they don't have to go home and cook. With regards to the community, let's talk a little bit about our community. So each hospital system has been actively engaged in the community. Things that the Cleveland Clinic has done, main campus, worked with supermarkets to bring food to patients who live in our areas, not just patients, but residents as well, to provide internet access to the main campus. They extended their internet blanket so that everybody living within a certain square mile of the people main campus would get free internet, because most people don't have access to that. And also providing access to the online COVID-19 toolkit, so people can go online and start to educate themselves as opposed to listening to television, being confused, and so forth. So not just the community of patients, but the community at large. So in addition to taking care of the community, not just our patients, but community at large, we've been able to start to attack some of the social determinants that are actually contributing to the way that this virus is manifesting itself in high-risk populations, which includes populations that are at risk because of access, lack of insurance and money, and jobs, and also the chronic conditions that tend to follow the poorer patients who are within the purview of our hospitals. We've also been able to partner with the mayors of each of the cities surrounding our areas. In the South Pointe area, we have partnered with all of them, and with the first response teams, to get them with testing, to get them PPE, and to protect them when they're coming in to bring patients to our space. And also to provide thermometers for them so that they can screen their employees. And then to partner with them with transportation of patients to, many of the patients actually have to be transported. And so we've done provided a lot of Uber rides for patients because of the distancing that has had to take place. And then with regards to the organization itself has actually openly and transparently embraced the fact that we have not furloughed anyone without pay, that we are going to embrace and keep every Cleveland Clinic person employed. But instead, if we have to cut costs, we're going to look for other ways of cutting costs besides personnel. And that is huge in this particular time. So in the midst of dealing with the actual virus itself, those are things that we've done. So let's then, so from an organizational standpoint, the responsibility is there, the awareness is there, and we're looking for other ways to cut costs within our organization that will not involve cutting any employee. Now, let's talk about our patients. All right, so I'm going to pull up some stats and give you the latest. I was waiting for it to come out this morning. Give me 1 second. And so far, we have done, we actually had prepared 2,500 intensive care unit beds that we had to come up with overnight in planning for the worst case scenario based on data from Italy, Spain, and New York. And having those, I would call them the canaries in the coal mine, helped to guide us so that we could be over-prepared to make sure we had enough personnel trained up with the latest techniques to provide the best outcome for patients who were COVID positive. And we have had a lot of, what's the word I want to say? You know, there's been a lot of uncertainty and a lot of day-to-day pivoting. As things change, our teams have been very responsive in responding to the change so that we'd end up doing the right thing for the best outcomes. So I'm going to give you some numbers. Today, we only have about, in all of our hospitals, we've got probably about 138 COVID positive patients, and most of those patients are not in intensive care. We have only had within the Cleveland Clinic Health System in Northeast Ohio, we've had under 110 deaths. And we have had patients in the thousands who have been positive for COVID. And that is a testament to the intensive care facilities that we have at the hospitals. What we did was we were able to cohort and separate hospitals to develop what we call centers of excellence around the management of COVID disease, so that the teams who were taking care of patients were intensely focused on just the COVID patient. And that allowed them to make rapid advances with regards to techniques like instead of ventilating every patient, some patients get ventilated differently. And also in terms of having, most times when you go to the intensive care unit, you see people lying flat on their back. We've learned that having them be on their belly allows you to oxygenate them better. That technique is called proning. And then embracing, they're doing lots of research projects here at the Cleveland Clinic, looking at all of the various therapies, what is really science and what is rhetoric, and being able to separate those to provide the best care for patients. It turns out that most people who do get COVID positive infections are really not going to die from their disease, but there are certain high-risk groups. We know patients over 85 years old, very high, 45% mortality. And so as a result, those are the people that are in nursing homes, right? And so we've actually partnered with the Ohio Department of Health and with the nursing homes to provide testing. And they're actually now going out, once a nursing home, many of our nursing homes have been hit, we will go out and test, we'll go out and test at the nursing home. So we've done a lot of advances with testing, and for us, we are not embracing every test. We're looking for the test with the highest accuracy, so that when we say that you have COVID positive, that you're positive, we are really sure that you are. And when we say you're negative, that we're really sure that you are. So those are just some of the things that we have done. And things that they're starting to look at is all of the multiple manifestations of the disease. It's no longer just flu-like symptoms like muscle weakness, cough, fatigue, fever. We're now seeing gastrointestinal symptoms, we're seeing sinus changes. We're seeing the blood clots that are going to the brains of young people. We're seeing some people are presenting with just nausea, vomiting, and diarrhea. And so it's starting to reframe our understanding of how this virus is actually working, because we could get that data from other countries and places that were hit hard, like New York. They really did not initially have the bandwidth. They were just putting out fires. They're pouring water to put out a fire. They didn't have the bandwidth to pause and to put aside teams that could address these. And so the clinic, because of its strength, they've been able to do that. So at this particular junction, I've been at the clinic for 25 years, but I will tell you right now, I'm so proud to be part of this organization. I'm going to go ahead and stop there, and I'm going to open it up for questions, and you can ask.
Great, thank you so much. And we have had a few questions come in.
Okay.
So to start, looking at testing, when will testing become readily available in the community, and can anyone get tested even if they are asymptomatic?
That's a great question. So I would say that currently there are two areas of weaknesses when we think about COVID-19. The first thing is universal testing. And so that is actually, there are many tests that are available, but I did say that we care about accuracy. So there's something called sensitivity and specificity, and we're actually looking to make sure that our tests would provide that. And so as a result, that will slow you down. Because when somebody comes and gets tested, you want to be able to tell them with 100% certainty, you don't have the virus, and vice versa. So I think that that is our weakness, and we're working on it. And so I would be happy to send out something to Marianne, who's the vice chair of our board, so that we can inform you when testing becomes universal. But that's what we're working on. And the reason is, it's like HIV. You want to be able to go and pick it up on the counter and do a swab and so forth. But right now, they're still perfecting that.
So how do you see the summer progressing in terms of infection rates? As people reassemble, do you anticipate additional spikes?
So, so the answer is yes. I think that Ohio, in Ohio, we're very lucky because our leadership of the state was able to really hone in and make recommendations and have mayors buy in. But everybody's tired. Everybody's tired of this. There are many people who are out of work, and people are just anxious. They don't like being sequestered. And so I would say that the message of, I think we're going to hit 90,000 deaths within the next 4 to 5 days. That is actually very compelling. That will make people do the right thing. So right now, what has happened with Cleveland and the Northeast Ohio area is that on the 14th of March, we had, actually the 13th, we had our first case, confirmed on the 14th. And then we started to see a gradual rise, and we peaked at 166 around April 23rd. We thought that that surge was going to go higher, but things leveled off. And they leveled off because everyone was paying attention. They were practicing SAFE. SAFE is an acronym we made up called 6 feet away from everyone. And, we were able to disseminate that and have that embraced by leadership in other places. So we're actually, I would say we've started, we peaked and then we're starting to gradually, but we're still pretty flat. As long as the hand washing, the masking, and the distancing, the social distancing are held, I think we're going to continue to see this flat curve. We're not going to go down to zero anytime soon. The summer is at risk for having a spike. So I think that as long as I think we can handle a little spike. I think that I personally don't see the state getting shut down again, but I also don't want to see the casualties that'll show up in the high-risk populations if we don't adhere to the things that we know will decrease the transmission. In fact, we know that for every one person who's infected, 2 to 3 people are at risk for being infected. So this is highly infectious. And I think we're going to be keeping a keen watch and having a high index of suspicion and working with our mayors and our leaders in the community to try to make sure that that doesn't happen. We're also giving our toolbox to organizations around so that they can also adopt the same methods as well.
So we know that listening to some of the stats about patient care and other non-COVID related health concerns, people haven't been going and getting their health care or seeing physicians. So do you anticipate any long-term impacts as a result of those patients that have delayed that routine care during the last several months and their ongoing concerns and fears of returning back to medical facilities?
So currently a big part of our daily work is focused on making our environments as safe as we can for clients to come back into our space for care. We are really, and we're getting that information out through correspondence. Every patient is getting that in their email or by a little note in the mail. There is some risk that some patients who already never liked seeing the doctor anyway are going to sit on things a little bit longer, symptoms, particularly symptoms that can wax and wane, as opposed to a woman who has a problem where she's bleeding. The bleeding doesn't really go away, right? So she will show up. But if somebody's got a little pain or a little ache, they will ignore it. And so, yeah, there's some risk there. The biggest things that we are concerned about is cardiac disease, having cardiac symptoms and not wanting to come in, or neurological symptoms of stroke and clearly people who might have cancers that we can catch early. And so right now we are actually really reaching out to patients. That's our campaign today, to try to let them know it's safe. You can still have just a virtual visit on a phone or an iPad, and then we can tell you, you can go get tested, or you know, we can order an ultrasound or a mammogram, and then we can see you urgently with in a safe environment. Other questions?
I think we have time for one more question. And as you look at all that you have going on, leading the hospital, taking care of your team, the patients that are coming in, how do you maintain your positivity day in and day out?
So I used to be an obstetrician. So I'm used to having shifts where I have to go in every night to have babies. And very early in my life, I developed some tools that have helped me that are centered around stress management. I would say things like, and I'm actually not a really good meditator, but boy, do I like to walk in the woods. So I would say get out, walk, communicate. Last week for Mother's Day, we had a Zoom call, which is a new paradigm. So the socialization is a big aspect of what you do. You know, and practicing things like autogenic training and other relaxation methods, minding your consumption of alcohol. And I would say reach out to your provider if you felt as though you were losing control. The problem is depression could be insidious as well as anxiety. And those are areas that we are a little ashamed to talk about. But I think that being bold would actually help you there. So for me, I'm actually very much of a ritual person. I have rituals that I do, and I've been doing it for the last 50 years of my life. And it includes in the morning when I get up, you know, for me, I start out with gratitude. I write it in a journal every morning. It's called Morning Pages by Julia Cameron's book, The Artist's Way. I do artist days where I will, I do lots of walks in the woods. Autogenic training has been, I would say, the #1 focus of my stress management toolbox, because what it does is, you know, I've been living a stressful life for the last 36 years. It allows your parasympathetic tone to override your sympathetic tone, which is your fight or flight. And when we're stressed, we're in fight or flight, and all those hormones are actually affecting our immune system function, or cortisol levels, or sleep. Autogenic training is a tool that can actually help you to overcome those. 15 minutes a day, and actually when you've been doing it long enough, that 15-minute autogenic training tool will last you for 5 days. And that's been the core. I taught my children, every one of my patients pretty much know about that tool because I've been sending them to it for the last 20 years of my life. So that's how I do it. And I'm also an optimist.
I think that's the key operative word, optimist. And Margaret, your positivity really is infectious. And I hope for those of you who haven't had the true pleasure of meeting Margaret in person, that you do have that at some point in the future, because then you will really feel it. So Margaret, thank you so much for giving so generously of your time and your knowledge.